Welcome to Burley-Stroker Chiropractic. I'm Dr. Stroker. Employing the K.I.S.S principles, keep it simple and safe, or keep it simple and specific, both principles apply. I'm going to demonstrate 3 stretches that I believe are both rehabilitative and preventative in nature. Our patient today is my son, Aaron. If you would, go ahead and lie on the table for me. The first stretch is called the Windshield Wiper. There are 4 components to it. The first component, or the basic component, is the movement of the hips and knees. From this position, you're going to let your knees roll from one side to the other, slowly, cautiously, gradually increasing the distance of each excursion. Okay? Good. A couple coaching points from this point. First of all, there's no set number of repetitions, and there's no set time period. You utilize this stretch until you feel like you've been stretched out, or your back feels relaxed. Number 2, allow your spine, or don't be concerned about your spine moving with your hips. Allow your spine to roll as far as it's going to go. Don't facilitate that or inhibit this movement. Okay? Number 3, with your feet closer to your body, if you're going to feel this stretch, you'll feel it in the lumbar region and migrate up your spine. Whereas with your feet further away, you'll feel this lower in your spine and more in your hips. So, this should feel different than it did previously. So what I ask patients to do is start low or with your feet further away and gradually move your feet closer to your body. Second component, as your knees go to the right, your head goes to the left. And now as your knees go to the left, your head goes to the right. Now we're going to get a little bit more work out of this stretch by utilizing this neck and the head to add additional torquing or movement to our spine. Third component, as your knees go to your right, your head goes to the left. At the end of that movement, take a deep breath and hold momentarily. As you transition to the other side, let your breath out. And again, when you get to the end of that movement, take the deep breath and hold this. Again, as you transition, let your breath out. That hold at the end of the movement with your deep breath is just momentary. You hold it as long as you like. It does not need to be any specific period of time. The 4th component. With your arms coming straight off your shoulders, try not to let them sway. And what you're going to do is you're going to try to stretch or reach as far as you can. During the stretch, I'll cue you when to employ the stretch or the reach, if you will. So now we're going to add the other 3 components. The knees go to the right, your head goes to the left. Take a deep breath. And at this moment, reach as far as you can. Elongate the body in this manner. Again, as you transition, if you leave your arms up here, as you transition to the other side, again, you'll take that deep breath at the end of the movement. At that point, you'll reach as far as you can. One more time. We'll move the hips to the right, or the knees to the right, the head will go to the left. Take the breath and reach as far as you can. Good. You can bring your arms together. So, you can implement these 4 components segmentally as I demonstrated to you, or you can employ all 4 components at the start of your stretch. So this is the end of the first stretch, and we'll move to the second stretch.